Dean Volk. I'm here at Volk Physical Therapy, and meet Miss Alice Linker. Did I get that right?
You did.
All right, Alice, when did we meet?
Today.
How long ago?
Less than 10 minutes.
Less than 10 minutes, and we have not done any treatment to you, but I asked you if you'd be willing to come on camera, and you said yes, correct?
Correct.
All right, so tell us, well, let me tell your story as quickly as I can on here, and you correct me if I'm wrong.
Okay.
You said in late July or early August of 2015, you started with some right shoulder and neck pain.
Yes.
And they did MRIs, they did all the studies. Hey, you can actually see me in the video. Hey. So, you had neck surgery September 9th of 2016, just this year.
Yes.
And maybe took a little bit of pressure out of the neck, but your shoulder pain is still the same. Went to an orthopedic surgeon. You have rotator cuff, a small rotator cuff tear with some bone spurs in that right shoulder. Is that correct?
Correct.
All right. So for the camera, seeing how we haven't done any treatment, we've just done a quick assessment. Show everybody how much you can raise that right shoulder for me. On a 0 to 10 pain scale, how intense is that?
7.
Okay. Now how about lifting it out to the side for me? How intense is that?
5.
5. All right. So what we're going to have you do, remember how I tested your left arm, just bringing it up and over your head? I want you to bring that left arm up and over your head 20 times. Bring it up as high as you can and down. I'm going to turn this off until we're about 18 or 19 so people don't have to watch the whole thing. 16, 17, 18, 19, 20. All right? When is the last time you actually had that right hand up over your head?
It's been over a year.
Okay, good. Now, I'm not seeing it's going over your head, but try to lift your right arm up and stop at the same amount of pain that you had last time. How's that feel?
Hurts.
Hurts? Does it feel any different?
No.
Okay, so this time what I want you to do, I want you to hold that left arm up over your head, and I want you to keep the elbow locked, thumb backwards. I just want you to bounce it at the top. Bounce it like that 25 times, and again, I'm going to turn this off and come back when you're almost done. 22, 23, 24, 25. All right, now Alice, go ahead and lift that right arm up for me as best you can. Stop when you have to. So going up a little bit higher.
Yeah.
And the pain's about the same there. So my rule of thumb is, you know what, if it's working, keep doing it. So let's try 25 more on that shoulder. I don't want that left shoulder to start hurting now, so go ahead and bounce it back as far as you can. Do it hard. And we'll come back at about 20 again. 22, 23, 24, 25, and here's Alice again. Let's see her lift that right arm up as best she can. Alice, what's happening?
I don't know, but I've been in 3 other physical therapies and I've not been able to do this.
That's awesome. Now, how many other physical therapies have them lifting your good arm up in the air?
No.
None of them. God bless them. All right. They're good for my business.
Right.
All right. Let's go 25 more, and then we're going to try sit to stands. 22, 23, 24, 25. All right, Alice, show me what you got with that right arm. What's the matter? Why are you smiling?
I can't believe it.
You can't believe it. All right, now, we just talked while the camera was off a second ago. When you came in, you said you had a constant level of pain in that shoulder of how much?
A good 6, 7 constant.
And that's your normal amount of pain that you have, just sitting without doing anything.
Right.
How much pain do you have in your shoulder right now?
It actually is not hurting.
So you have no pain, 0?
No.
When's the last time you had 0 pain in your shoulder?
Over a year ago.
Over a year ago, and all we did was left arm lifts.
Yeah.
Scratch your head and say, what are you doing to me, man?
I know.
Awesome. We're going to have you do some sit to stands. You said that you had about a 35% difference. Your right leg was much easier to stand up on, so I'm just going to move around here. Go ahead and do some sit to stands for me on that right leg. So lift your left foot up off the floor and go ahead and do some sit to stands for me. I want you to do that 10 times up and down. 2. More for the camera. She just did 10. That was number 11. Have a seat. So let's see what you got with that right arm now. It's about 120 degrees. Now at the top, how intense is the pain?
Actually, it's not. It's right here. I feel it, and then it goes away.
But no pain at the top.
No.
What stops you from going all the way up and over your head?
Probably scared.
Okay. Keep on going as far as you can. What stops you there? Is that painful?
It gets tight.
Tight. So after a year of not being up there, it's tight.
Yeah.
So, you've been dealing with this for over a year now.
Mm-hmm.
You've had neck surgery,
Yes.
had an MRI which showed rotator cuff tear with some bone spurs.
Yes. Multi MRIs.
Multi
Nerves,
MRIs.
nerve studies that are not fun.
Okay. And right after I did the initial eval and just going through some testing, I just said, hey, are you a shy person? And you said, not really. And I said, would you mind me videotaping? And you sort of thought I was kidding, but you said, absolutely.
Yeah.
And when I brought the iPad in, you said, oh, you're really going to do this? And so now I just got a question for you.
Okay.
For anybody out there who's watching, who's had shoulder pain, who's had shoulder problems, who hasn't been able to move their shoulder because of too much pain, what would be your recommendation to them as far as physical therapy, trying physical therapy, or getting it taken care of? Because most people, when they first get some shoulder pain, they just go, you know what, I'll just stop using it and it'll go away.
Right.
And that's probably something that you did.
Oh yeah.
And how long did you deal with it before you actually got help?
Probably about 5 months I dealt with it.
Okay. Now, what would you tell somebody who's struggling with some shoulder pain? What would you have them do?
Had their doctor refer them here
To Volk Physical Therapy?
to Volk Physical Therapy.
Did I say Volk with V-O-L-K, Physical Therapy?
You did.
Alice, you're awesome. I appreciate it. Thank you very much.
You're welcome.